Hi, my name is Guy-Ringler, and I'm a reproductive endocrinologist with California Fertility Partners in Los Angeles. We see international patients quite often. We're seeing more and more patients from around the world, from throughout Europe, Asia, Australia, and they're coming for services that may not be offered in their countries. So for egg donation, surrogacy, advanced reproductive procedures that they may not have access to in their own country. Well, California Fertility Partners has been in existence for over 25 years, and my senior partner, Dr. Richard Mars, is internationally known as being one of the innovators, one of the founders of IVF. So for years, we have attracted patients from around the globe, and with years of experience brings organization and attention to detail and a structure that enables us to accommodate the needs and demands of patients who are undergoing medical treatment from abroad, and it requires staff that can speak several languages, access to interpreters and translators, and frequent and open communication with clinics and facilities around the world that can help us in monitoring these patients. And of course, the internet and email makes it so much easier to remain in constant communication with patients. Patients may contact us via the internet or through an agency, and we can set up an initial consultation over the phone or preferably in person. So they may travel to Los Angeles for the initial consultation, and the initial consultation includes an exam, an outline of diagnostic testing we might need prior to initiating treatment, and they may be in town for a couple of days or for a more extended period of time. At the time of the initial consultation, we like to review their past medical history, past treatments, perform an examination, and outline an individualized treatment plan for them. And we can oftentimes set up the treatment plan months in advance and organize it according to their travel schedules. It's always helpful if patients can send in their prior medical records before that initial consultation so we can review what's been done. Because it's very important, I believe, to individualize the treatment plan according to the individual patient and their past treatment. We can do initial consultations over the phone, provided we have their past medical records. So it's not necessary to be seen in person. We can initiate the conversation, the evaluation, over the phone or by Skype. We can usually find outside laboratories, facilities, throughout the world to do baseline ultrasound exams, hormone assays, semen testing, and because of our facility here at California Fertility Partners is well established and well known throughout the world, there are many physicians in reproductive medicine that are more than willing to help us monitor our patients. Sometimes with patients from countries that may not allow a certain treatment, like surrogacy, their local physicians may not be able to do the initial ultrasound exams and the monitoring that could help them in the process and help minimize the time spent in Los Angeles. So we try to help the patient find the appropriate physician or laboratory that may be willing to carry out the procedure for us. So the amount of time required to be spent in Los Angeles really depends on the treatment that you're undergoing. If you're undergoing an IVF cycle with embryos transferred back into yourself, then we'll probably want to see you here for 7 to 14 days, depending on your access to IVF monitoring facilities where you live. If you're undergoing an egg donation cycle with embryos transferred into yourself, we can really cut that down quite a bit because intensive monitoring is for the egg donor and much less monitoring is required for you as the recipient of those embryos. So you may only need to be in Los Angeles for several days. If you're undergoing IVF with embryo transfers into a gestational carrier, you may need to be in Los Angeles for a week approximately. If you are undergoing an egg donation and surrogacy cycle and you're only providing the sperm, you may only need to be in Los Angeles to provide the semen sample.